the each compartment, right? So there's anterior, lateral, and then the posterior one has the superficial and the deep. So you can try to open up everything. So while you are working on the posterior side of it, you can open up the posterior compartment first. Then now you're gonna working on more the anterior part of it, and then anterior and between the lateral and anterior part of it. So you can go target the septums in between. So usually you can target one side, the proximal part, hold down to it, and then use the spreading technique to opening up, just release the septum. And septum goes a little bit thinner when it comes to the muscle belly part. And then they may have some septums down here too, where you can separate these tendons for the anterior, then these tendons for the lateral compartment, and then you can spreading up that one, and then where it attaches onto the bone. So like there is a anterior border of the tibia, right? And then these structure, there's no muscle, it's all bone and skin and fascia, right? So you're gonna try to spread those anterior part, and then from the tibial tuberosity, and then spreading technique. You can go all the way down along too, as long as your patient can take up the pain. And then you're gonna opening up the area, so kind of ticking up from the edge of the compartment here, edge of the compartment here, and then picking up to opening up the area. Do you feel okay? Not too much? Yeah. So what I'm not going to do too much is gonna be pressing, pinning down, and then do the stripping like that way too much, because it's compression injury, right? So you are not doing too much of the compression. You can working on a little bit, but I wouldn't do too much of those techniques.
So you're just more sort of like doing peeling kind of thing? Where
yeah, peeling off, like opening up, like those kind of the technique more than compressing down.